There you go.
Okay, so today we are going to go over the pigtail chest tube, and we'll also review how to operate a stopcock. So a couple of things about the pigtail chest tube. This is actually what it looks like on the inside of the patient's body. As you can see, it's like a little squiggly pigtail. That's why they call it that. And these are typically used, they're very small. This is a very tiny chest tube as far as like the diameter. So these are typically used in the case of a patient who has just a pneumothorax, might not have actually like a lot of blood in there, but just needs to get the air out of the chest. So it's more comfortable for the patient. So that is often why a physician would insert this pigtail chest tube over the regular chest tube that we insert. So that's just some of the basics there. Now what you're gonna see if the patient has a pigtail chest tube is this, you won't see this on the inside of the patient. You're gonna see this kind of strange connection piece here. It's just a part of the chest tube valve, so don't worry about that very much. And this is gonna be connected over to the end of the pigtail, the end of the stopcock. So what we're gonna show you here is the correct way to ensure that the stopcock is open and the suction on your chest tube is working. So we created this visual so you can kind of see the flow. And imagine this red coloring that looks like blood is the air flow through the chest tube. So when you have it in the right position, like this, as you can see, the flow is going through. So that's what you want when you have a pigtail chest tube. You want to make sure that that flow of air and suction is working. Otherwise, the patient will likely continue to have the pneumo and it could worsen. So we just created this so that you can see it as a visual. You're going to want to have it in this position, and you're going to want to assess on your chest tube drain, your atrium. You're going to be looking for the orange bellows. I don't have one in here because we would have to have it hooked to suction to work, but on your